you for the opportunity to testify. I'm Joanne Cunningham, the president of the Home Care Association of New York State. HCA is a trade association that represents more than 400 not-for-profit, public, and proprietary home care agencies and others who are committed to the provision of home care services to New York's vulnerable, elderly, disabled, special needs population, including children. Home care, as most of you know very well, is the safety net of the healthcare system and allows patients to move through the healthcare system out of hospital, avoiding higher levels of care, nursing home placement, and it's really doing a marvelous job, innovation, telehealth, chronic care management, and has successfully been keeping patients in their homes. Home care works, and yesterday many of you came to our advocacy day in the plaza and spoke to home care's benefits, and we greatly appreciate that support over the years. Our membership are agencies that have a very long and rich history in New York State. Many of our agencies are, in fact, among the nation's oldest home care agencies. The VNS of New York City is the nation's oldest home care agency. The Montefiore Medical Center Home Care Agency is the nation's oldest hospital-based agency. So we have a really rich history that if you travel across the state, you can also see in smaller communities upstate. The VNA of Central New York is I think, 130 years old. So these are agencies that have worked tirelessly through many, many years to develop programs to serve the most vulnerable needs of their patients. We also represent New York State's 108 long-term home health care programs, which is a program that is 35 years old this year. It's a nursing home without walls, or known as the Lombardi program, which at the time, 35 years ago, was created as a predecessor of even the federal home and community-based waiver system. The Lombardi program actually set in motion a whole federal initiative that other states later adopted, where they were trying to keep patients who are nursing home eligible in their homes. So it's a marvelous example of New York's innovation. First, I would compliment the previous speaker, Christy Johnston, on her remarks and associate them with HCA with those remarks as well. One of the things that's taking hold, and your budget testimony reflects this, the aftermath of the MRT proposals impacting home care has been rather chaotic and has invited a lot of destabilization for the home care sector. And right now, and those of you who met with your home care providers yesterday probably heard this very, very clearly. Home care providers are having a very, very difficult time with the transition to mandatory enrollment. So I guess I would characterize HCA's position at this point is not debating the what has been done through the MRT, but really debating the how and helping to put in place mechanisms, legislative safeguards to assure that this transition to mandatory enrollment can preserve patient access, can protect the rights of patients and consumers, and also offer providers, community-based providers that have been in your communities for a long, long time, offer them some predictability, a place to go, a pathway, and some stability. The aftermath of the MRT was essentially a policy change that affected the home care structure dramatically. On top of that, the home care sector was hit with about $500 million in reimbursement cuts. Christy spoke about the need for some mitigation efforts, agencies that are dealing with those cuts, who are trying to stay afloat, who are concerned about fiscal stability, of waiving interest, of waiving penalties. That seems like a very reasonable thing to do to help agencies adapt to essentially what is a massive amount of cuts aimed toward home care. In addition, Christy also mentioned the wage parity mandate. And there's true chaos right now surrounding the implementation of that. And while the department has very receptive to the questions that HCA and others have raised about the implementation and the need for clear guidance, they have not been able to really provide adequate information that is going to allow for a smooth transition on March 1 on the wage parity issue. And I thank Senator Hannan for your commitment to helping us sort that through, because it's a really important transition issue that the home care sector needs a lot of help with. Some of the chaos and the questioning and the uncertainty that is taking hold in home care agencies right now really focuses on the fact that they are having a really hard time figuring out what they're going to be, how they're going to participate in this new marketplace. There's not a lot of direction related to continuity of care, patient transition, how their patients come April 1, and most of the changes that are coming related to mandatory enrollment get set in motion on April 1, how those patients are going to continue to receive the services that many of them have been receiving, by some of them the same caregivers for years and years, how that transition is going to happen. So while the department actually today or yesterday had released some FAQs related to some of those transition issues, there's still more to be known, and we need more guidance related to the specificity of those transition issues. How are those 108 long-term home health care programs who are serving 30,000 patients right now, what is their role going to be? Is it as a contractor, and if so, under what terms? Are they going to continue to provide services as they have done, which is a customized arrangement of services designed to meet a nursing home eligible population's needs? How is that going to work? We need guidance, we need clarity, and we need a pathway. Other agencies that are part of hospital systems are thinking through how they interact in a system where they're trying to look at their community's needs and take care of their community, and they're looking at health homes and ACOs. They need a more responsive system on the Medicaid side that allows them to transition their patients to their systems. There's also a need on the part of the plans, the MLTCs, for the same kinds of clarity related to those continuity of care issues. How are plans, what are the expectations for them related to continuity of care, related to new roles and responsibilities that may become theirs instead of the home care agencies. So many of those questions need further articulation. We need some legislative safeguards that the legislature could proactively put in place in this year's budget that would help figure out and provide a roadmap that would offer patient protection, provider safeguards, and offer stability to this system. The other thing I would say is, and many of the speakers, the health department speakers, spoke of this transition, implying that it's been sort of a more orderly transition than we have heard from our provider community. And many things to think about related to this. When you think about the home care population, these are daily consumers of home care services. They are quadriplegics who live on fourth-floor walk-ups in New York City with AIDS and HIV. They're receiving care daily. Moving them into a managed care environment or a managed long-term care environment, we have to make sure that we are providing safeguards so that they are going to have an orderly transition to assure that they're going to have their needs met. The other element is that home care, one of our speakers yesterday actually spoke of it this way. Home care providers are in the patient's living rooms and kitchens and cupboards and bedrooms and bathrooms. They are very intricately involved in the lives of their patients. They're in their homes. When a home care patient has a home that is infested with bed bugs, whose responsibility is that to deal with that issue? Right now, it's the home care agency's responsibility. In the personal care transition in New York City that took place starting August 1, the managed care plans said point blank, that is not what we envision our role to be, is dealing with patient bed bugs. Those are big questions. If a patient needs Meals on Wheels, home care right now arranges that. A patient needs transportation, home care right now arranges that. They need family caregiver training. Home care right now arranges that. We need help in clarifying whose job is that in a new mandatory enrollment system. And we got to make sure that the roles are clear and that the payment is enough to support the continued provision of those social services that are provided through the home care sector. Again, I just want to thank the legislature and the committee for inviting me to testify. Again, we would ask for your help and support in your one-house budgets for protections for patients, for some provider stability, language that could be inserted to help with the transition and help figure out how we offer a pathway and a place for your community-based providers to continue to function effectively in this new system. Thank you very much for the opportunity to testify.